We're now going to be tackling an important health issue that affects millions of people around the world: obesity. Now, for years it's been viewed as simply the result of poor lifestyle choices, but more and more the medical community is recognizing it as a complex, chronic disease, one that involves genetics, biology, mental health, and the environment. To further unpack this topic is Dr. Mark Opperman from the T Clinic. Now, Mark, obesity from a big picture perspective, let's just understand why this now is considered a chronic disease.
Michael, for anything to be a disease, it has to adhere to three principles. It must cause a change in function. So when it comes to obesity, we're taking a look at dyslipidemia, that the fat cells don't function, non-alcoholic fatty liver disease, etc., etc.
Okay.
So there needs to be a change in function. The next thing is there needs to be clear signs or symptoms. So in the case of obesity, excess accumulation of body fat, and that body fat that can lead to problems like rheumatoid arthritis or joint pains, etc., etc.
Okay.
And then the last one is it needs to cause harm. Now, in the case of obesity, we're thinking of diabetes, cancer, hypertension, obstructive sleep apnea, polycystic ovarian disease. So obesity adheres to all three criteria that is needed to be a disease.
Okay.
And it's been classified as a disease almost for 2 decades now.
Okay.
And you said that, there's millions of people. The statistics are shocking. 1 billion people, one of the 8 billion people in the world today is obese.
Sure.
And when we take a look at overweight, it's 1 in 5.
Okay.
So this is a serious health condition. It's a pandemic of epic proportions with no sign of slowing down.
And Mark, I mean, there's a lot of stigma around obesity because it's been considered something that is just a lack of willpower or poor lifestyle choices, things like that. But again, here we're not just talking about, it's not let's call it fat shaming. We're talking about the health implications of obesity and the characterization, as you mentioned, of these systems in the body that are being affected. To help us understand why people are still like, oh, I'm not obese, I'm just a little bit overweight.
Michael, I think we need to understand that you can get overweight people that are healthy. As we said, obesity is a disease, so there's the 3 different criteria. So someone can be overweight, but it doesn't have a change. It's not changing metabolic function. It's not causing harm to the patient. They don't have diabetes, hypertension, etc., etc. But what we need to understand is there's many paths that lead to obesity. One that for me was actually an eye-opener is that between 40 to 70% of patients that deal with overweight and obesity is because of a genetic makeup.
Okay, interesting.
Then we also have the environment. Where do you stay? What's your access to healthcare, socioeconomic things? Then there's also the psychological part: stress, depression, anxiety. All of those lead to obesity or can lead to obesity. Medical conditions, hormone imbalances, so your endocrine system, thyroid problems, etc., etc. And the one that people forget is common medication that we use on a daily basis. I think so many people are on antidepressants and they can cause weight gain.
Yeah.
So many people are on blood pressure medication, especially beta blockers, etc., etc. They can cause weight gain. So we actually need to understand that there's many paths that lead to obesity. It's a multifactorial disease and it's common.
Right. Now, from a diagnosis point of view, Mark, I mean, BMI is something that people are very familiar with, but is this still the way that obesity is diagnosed?
Absolutely not. I think BMI has fallen out of favor. I read a study a couple of days ago where over 60 medical associations have now formed a consensus that BMI is not the only way. So we need to have an excess of fat accumulation with a risk factor, or that's causing an increase in your risk for disease. So this is dyslipidemia, hypertension, diabetes, etc., etc. We are also taking a look, and this is becoming far more acceptable now, is abdominal circumference,
Okay.
height to weight ratio, as well as hip to waist ratio.
Okay.
So BMI, no, because if you take one of our rugby players, for instance, he will have a BMI of way above 30.
Yes, yeah.
And therefore he'll be obese. But there's not fat accumulation.
Okay.
So BMI is falling out of favor, and it will fall out of favor faster in future.
Right. Now, when it comes to children and teens versus adults, are they affected or categorized in the same way in terms of obesity?
I'm glad that you asked that question, because the numbers are shocking. Michael, if we take a look, I've mentioned worldwide, one in 8 people are obese, 1 in 5 overweight. In South Africa, 23.4% of men are obese, 46% of women, and for me, this is the shocking one, 23% of children. Children between the age of 5 and 9, we're looking at 16%.
Wow.
And between the ages of 9 and 14, over 16%. So children just as badly affected. And this is because of lifestyle. And then socioeconomic factors like diet that play a role.
Absolutely.
For so long, we saw that fat was associated with higher income. Today, the highest incidence and the biggest burden on healthcare systems is the double whammy of poor people and undernourished people, because they don't have access to healthy food. To feed a big family, you're going to buy stuff that's mass-produced, highly processed, and that leads to problems. So it really is a big problem that the world is facing.
Yeah.
And as I said earlier, there's no sign of this slowing down.
Yeah, absolutely. And what are the impact or the implications of long-term untreated obesity?
Michael, it's simple. You're going to put yourself at risk. Diabetes, definitely. A higher incidence of cardiovascular disease, so heart attack, strokes, kidney dysfunction. But the ones that people forget is obesity leads to obstructive sleep apnea. We've spoken about sleep apnea and the problem that has on this program repeatedly. Also, cancer. There are over 230 diseases associated with obesity. And we know the common ones: hypertension, cardiovascular disease, diabetes. Breast cancer, colorectal cancer, prostate cancer, endometrial cancer are worse when it comes to obesity, the risk for developing those conditions, and then rheumatoid and osteoarthritis. So, it affects every single system in the body, and every single speciality in medicine is affected by obesity.
It's amazing the impact is so far reaching. But Mark, we are going to be chatting further about obesity, ways to manage it, what options there are out there. But for the moment, just remind us, please, how we can get in touch with you if you'd like to find out more.
The T Clinic, our website is www.thetclinic.com. We're based in Bryanston. We consult with patients all over South Africa and the world. And the phone number is 010-824-1393.
Wonderful, Mark. Thank you so much. We'll see you again next week.